The South African Medical Association is calling on doctors to unite and promote COVID-19 vaccinations. This after reports of healthcare workers, including doctors, discouraging patients from getting the jab. They're allegedly casting doubt on the safety and effectiveness of vaccines. Let's speak now to the vice-chairperson of the organization, Dr. Mvuyisi Mzukwa, who joins us from Durban. Doctor, thank you so much for your time. I was quite shocked when I realized that this was actually an issue that we had to deal with. Scientists, our healthcare workers, not just taking their making their own decision about whether or not to get the jab, because I do realize that when vaccinations became available for healthcare workers, that there was an issue about healthcare workers that weren't sure whether or not they wanted the vaccine. But now we're hearing reports that they are actively discouraging ordinary citizens from getting the vaccine. What can you tell us of these reported incidents?
Well, good evening, Marcel, and to your viewers. Thank you for having the South African Medical Association in your program. We are truly concerned as the South African Medical Association, following the reports from the media that there are some of our colleagues who are trained medical personnel, who are doctors, some of them even to a level of a professor, who are out there discouraging patients from taking COVID-19 vaccines. We know that South Africa has already, as you alluded to earlier, lost about 77,000 people. We know that this is posing a huge risk to the public health. Hence, we took a proactive stance as the South African Medical Association to warn our colleagues to say vaccinations have been proven to be working, they have been proven to be effective, but also they've been proven to be safe. We know that there are cases where there are reported adverse effects on patients and that are being managed, but we know that there's very few of those. But we know that as a doctor, you are encouraged to practice, according to the international best practice. And you can't be found on the other side where you are discouraging patients from getting vaccinated based on your opinion or on your belief. I think that's where we needed to come in as the Medical Association to really unite our doctors to support vaccination, because as the association, we do support vaccination because we've seen that it is effective, especially in our context in South Africa.
Now, it's already been so frustrating. We keep hearing about people taking information from what they see, what they receive on WhatsApp, what they're getting on social media, and they're taking that information and basing their decision on vaccinations on that, and not from healthcare workers and from scientists. Can any action be taken against a healthcare worker who is found to be discouraging people from taking a vaccine? Because some would argue that this goes against the very oath that you take as doctors to care for people.
Yeah, thank you so much. That's very true, Marcel. We know that, one, we have our HPCSA, the Health Professions Council of South Africa, that is looking into the conduct of professionals. And also, we know that some of our colleagues have already been reported to HPCSA for this misinformation on vaccination. But also, we know that according to the Disaster Management Act, if you are found to be supporting, information or misinformation on COVID-19 and other and vaccination, you could be found to be on the other side of the law and be charged for that. And there's imprisonment to that effect. But also the problem that we are also facing is that, I mean, these are healthcare professionals who have huge influence to the public, who are now working against science and the scientists. We know that in the country, our scientists have been advising government. We know that SAPRA also is driven by scientists, and they've approved of these vaccines based on the data available, in terms of safety and efficacy. So we really urge our colleagues to not be found on the other side of the law.
What is your advice to ordinary people who perhaps go in to see their doctor for consultation of some kind, or colleagues in the industry, healthcare workers who hear a healthcare worker giving that kind of advice or discouraging people from taking a jab? What can people do if they come across somebody doing that?
I think we have all, as citizens of the country, we have a responsibility to report that to either the healthcare, the HPCSA, that is our council. Also, we can report it, in any way, report it to SAPRA as well. But I think we need to understand that vaccinations need to be taken by all of us, because especially for those who are vulnerable, like your elderly population, like those who have got underlying medical conditions. We really, would urge those people to take vaccination. But on top of that, if there are side effects, those side effects are supposed to be reported to SAPRA, and the healthcare professionals are supposed to be assisting those people to report side effects if there's any side effects. Nobody is saying that side effects must be hidden from the public or not reported anyway. But there's a platform. As professionals, people would know that there are platforms where you report side effects if there's any.
Okay, we're going to leave it there. Thank you so much for your time this evening. That's Dr. Mvuyisi Mzukwa, SAMA Vice President, encouraging doctors to unite and encouraging South Africans to go and get vaccinated.